What are the recommended steps for proper hand washing according to the Centers for Disease Control and Prevention, CDC? A. Wet hands, apply soap, scrub for 5 seconds, rinse, and air dry. B. Wet hands, apply soap, scrub for at least 20 seconds, rinse, and dry with a clean towel. C. Apply soap, scrub without water, use a sanitizer, and dry with a towel. D. Scrub hands with sanitizer, rinse with water, and dry. The correct answer is B. Wet hands, apply soap, scrub for at least 20 seconds, rinse, and dry with a clean towel. The CDC recommends wetting hands with clean, running water, applying soap, scrubbing all surfaces of the hands for at least 20 seconds, rinsing them under clean, running water, and drying them using a clean towel or air drying. This method ensures the removal of germs and prevents the spread of infections. How do isolation precautions impact the psychological well-being of patients, and how can CNAs help mitigate these effects? A. Isolation precautions have no impact on psychological well-being. B. They can lead to feelings of loneliness and anxiety, and CNAs can help by minimizing interaction to reduce stress. C. They can lead to feelings of loneliness and anxiety, and CNAs can help by providing regular emotional support and maintaining open communication. D. They improve psychological well-being by providing patients with more personal space. The correct answer is C. They can lead to feelings of loneliness and anxiety, and CNAs can help by providing regular emotional support and maintaining open communication. Isolation precautions can isolate patients from their usual social interactions, potentially leading to loneliness, anxiety, or depression. CNAs can mitigate these effects by engaging in empathetic communication, spending time with the patient when possible, and facilitating virtual visits with family and friends. Explain the importance of proper PPE selection based on the type of patient care activity. A. All PPE offers the same level of protection for any care activity. B. Proper PPE selection is only necessary for surgical procedures. C. Proper PPE selection is important to ensure the safety of the patient but not the healthcare worker. D. Proper PPE selection is crucial to provide appropriate protection against specific pathogens or hazards encountered in different patient care activities. The correct answer is D. Proper PPE selection is crucial to provide appropriate protection against specific pathogens or hazards encountered in different patient care activities. The correct selection of PPE, based on the type of patient care activity, is essential to ensure that healthcare workers are adequately protected from exposure to infectious agents or other hazards. Different activities may require different levels of protection. Identify the types of items that must be disposed of in a sharps container after use in patient care. A. Gloves and gowns. B. Needles, syringes, and lancets. C. Paper towels and bandages. D. Medication bottles and 4 bags. The correct answer is B. Needles, syringes, and lancets. Sharps containers are specifically designed for the disposal of items that could cause cuts or puncture wounds, including needles, syringes, and lancets. These items pose a risk of injury and potential infection if not properly disposed of. Describe the types of linen that should be disposed of in a biohazard bag rather than being sent to laundry. A. Linen that is lightly soiled with non-infectious substances. B. All bed sheets, regardless of contamination. C. Linen that is heavily soiled with blood or bodily fluids and is deemed unsalvageable or poses a risk of infection. D. Linen used in the dining area. The correct answer is C. Linen that is heavily soiled with blood or bodily fluids and is deemed unsalvageable or poses a risk of infection. Linen that is heavily contaminated with potentially infectious materials and cannot be adequately cleaned or poses a risk of infection during the handling or laundering process should be disposed of in biohazard bags. This measure prevents the spread of infections and ensures the safety of healthcare workers. What is the most common type of accident for clients in healthcare settings? A. Medication errors. B. Falls. C. Burns. D. Equipment-related injuries. The correct answer is B. Falls. Falls are the most common type of accident in healthcare settings, especially among older adults. They can result from various factors, including mobility issues, medications that affect balance, and environmental hazards. What steps should CNAs take to ensure the safety of clients during a severe weather warning? A. Wait for the weather to improve before taking any actions. B. Follow the facility's emergency plan, ensuring clients are moved to safe areas and have access to emergency kits. C. Advise clients to watch the news for weather updates. D. Encourage clients to go outside and assess the weather conditions themselves. The correct answer is B. Follow the facility's emergency plan, ensuring clients are moved to safe areas and have access to emergency kits. CNAs should actively participate in the implementation of the facility's emergency preparedness plan during severe weather warnings. This includes moving clients to designated safe areas, ensuring they have access to emergency supplies, and maintaining calm and order to prevent panic. What initial steps should a CNA take upon hearing an active shooter alert in their healthcare facility? A. Immediately leave the building regardless of client's conditions. B. Seek immediate shelter, locking or barricading doors if possible, and ensuring silence in their area. C. Continue with their tasks until more information is available. D. Search for the shooter to understand the situation better. The correct answer is B. Seek immediate shelter, locking or barricading doors if possible, and ensuring silence in their area. Upon hearing an active shooter alert, the CNA should first ensure their safety and that of their clients by seeking immediate shelter. Locking or barricading doors can provide a temporary safe space, and maintaining silence can help avoid attracting the shooter's attention. What is the importance of understanding a client's code status for a CNA? A. To determine the client's dietary preferences. B. To understand the client's personal background. C. To ensure appropriate emergency response actions are taken. D. To know the client's room number. The correct answer is C. To ensure appropriate emergency response actions are taken. Knowing a client's code status helps CNAs ensure that in an emergency, they respond in a way that respects the client's wishes and legal instructions regarding life-saving interventions. What immediate actions should a CNA take to ensure client safety during a sudden power outage? A. Leave clients alone and find a light source. B. Ensure all clients are accounted for and safe, then assist in implementing the facility's emergency plan. C. Immediately start evacuating clients from the building. D. Continue with routine care as if the power outage did not happen. The correct answer is B. Ensure all clients are accounted for and safe, then assist in implementing the facility's emergency plan. In the event of a power outage, the CNA's priority is to ensure the safety and security of all clients. This involves quickly accounting for everyone's presence, ensuring they are safe, and then following the facility's established emergency procedures, which are designed to handle such situations. How can a CNA identify the signs of a client who is choking? A. The client is speaking clearly and calmly. B. The client is coughing lightly and can breathe easily. C. The client is unable to talk, breathe, or is making high-pitched noises. D. The client requests something to drink. The correct answer is C. The client is unable to talk, breathe, or is making high-pitched noises. A choking person may be unable to speak, breathe, or might make high-pitched sounds due to the blockage in their airway. The inability to talk or breathe normally and the presence of high-pitched noises are critical signs indicating that the airway may be partially or fully blocked. What does CPR stand for, and what is its primary purpose in emergency care? A. Cardiopulmonary response, to restore breathing. B. Cardiac pulmonary resuscitation, to treat heart attacks. C. Cardiopulmonary resuscitation, to restore normal heart rhythm. D. Cardiopulmonary resuscitation, to maintain brain function until further measures. The correct answer is D. Cardiopulmonary resuscitation, to maintain brain function until further measures. CPR stands for cardiopulmonary resuscitation. It is a life-saving technique used in emergencies when someone's breathing or heartbeat has stopped. The primary purpose of CPR is to maintain vital blood flow to the brain and heart, thereby keeping the individual alive until more definitive medical treatment can restore normal heart and lung function. What are the first steps a CNA should take when preparing to make an occupied bed? A. Place the bed in the lowest position. B. Collect all necessary supplies. C. Explain the procedure to the client. D. All of the above. The correct answer is D. All of the above. The first step involves ensuring everything needed is at hand. B. Lowering the bed for safety. A. And communicating with the client to inform them and gain consent. C. This ensures efficiency and respects the client's autonomy. What strategies can a CNA use to dress a patient with one-sided weakness effectively? A. Dress the stronger side first. B. Dress the weaker side first. C. Use tight-fitting clothes. D. Avoid talking to the patient to maintain focus. The correct answer is B. Dress the weaker side first. Dressing the weaker side first makes it easier for the patient to assist with the stronger side, reducing strain and making the process smoother. What are the guidelines for deciding when to use restraints on a patient? A. When the patient requests them for comfort. B. As a convenience for the staff. C. When less restrictive measures have failed and the patient is a danger to themselves or others. D. Based on family requests. The correct answer is C. When less restrictive measures have failed and the patient is a danger to themselves or others. Restraints should only be used as a last resort when non-restrictive interventions have been tried and proven ineffective, and the patient poses a significant risk of harm to themselves or others. This aligns with ethical guidelines and patient rights, emphasizing the importance of patient safety and autonomy. How does a CNA correctly identify the axillary area for temperature measurement? A. By finding the upper arm area. B. By locating the center of the forehead. C. By identifying the area under the patient's arm. D. By locating the patient's wrist. The correct answer is C. By identifying the area under the patient's arm. The axillary area refers to the area under the arm. For temperature measurement, it's important to correctly identify this area as it is where the thermometer is placed to obtain an axillary temperature. What are considered abnormal readings for an adult's temperature, pulse, respiration, and blood pressure? A. Temperature greater than 99.5 degrees Fahrenheit or 100 bpm or 20 breaths/min or 140/90 mmHg or less than 90/60ths millimeter of mercury. B. Temperature greater than 101 degrees Fahrenheit or 90 bpm or 16 breaths/min or 130/80 mmHg or 100/70 mmHg. C. Temperature greater than 100 degrees Fahrenheit or 80 bpm or 18 breaths/min or 120/80 mmHg or 110/70 mmHg. D. All of the above. The correct answer is A. Temperature greater than 99.5 degrees Fahrenheit or 100 bpm or 20 breaths/min or 140/90 mmHg or less than 90/60ths millimeter of mercury. Normal adult temperature usually ranges from 97 degrees Fahrenheit to 99 degrees Fahrenheit. A normal pulse rate for healthy adults ranges from 60 to 100 beats per minute. Normal respiration rates for adults are between 12 to 20 breaths per minute. Normal blood pressure is less than 120/80 mmHg. Any values above or below these ranges are considered abnormal and may indicate health issues. What supplies does a CNA need to gather before giving a bed bath? A. Gloves and a pillow. B. Basin, warm water, soap, gloves, washcloth, towel. C. Bedpan and urinal. D. Blood pressure cuff and stethoscope. The correct answer is B. Basin, warm water, soap, gloves, washcloth, towel. Before giving a bed bath, a CNA must gather all necessary supplies to ensure the process is smooth and efficient. These include a basin for the water, soap for cleaning, gloves for infection control, and a washcloth and towel for washing and drying the patient. This helps in maintaining hygiene and comfort for the patient. How does a CNA ensure the patient is comfortable and safe throughout the bed bath process? A. By rushing to complete the bath quickly. B. By using cold water to refresh the patient. C. By maintaining the patient's privacy and using a gentle touch. D. By leaving the patient alone briefly to ensure privacy. The correct answer is C. By maintaining the patient's privacy and using a gentle touch. Ensuring the patient's comfort and safety involves maintaining their dignity by keeping them covered as much as possible, using a gentle touch to avoid discomfort or injury, and making sure the water temperature is comfortable. What are the key steps for ensuring proper care of an indwelling catheter? A. Regular hand washing and wearing gloves. B. Keeping the drainage bag below the level of the bladder. C. Checking for kinks in the tubing regularly. D. All of the above. The correct answer is D. All of the above. Proper care of an indwelling catheter includes maintaining hygiene by regular hand washing and wearing gloves, ensuring the drainage bag is always below the bladder to prevent urine backflow, and checking the tubing for any kinks to ensure urine flows freely. How should a CNA position a patient before beginning to feed them? A. Lying flat on their back. B. Sitting upright at a 90-degree angle. C. In a semi-reclined position on their side. D. Leaning forward at a 45-degree angle. The correct answer is B. Sitting upright at a 90-degree angle. Positioning a patient upright at a 90-degree angle helps prevent choking and facilitates easier swallowing by aligning the throat properly. This position uses gravity to assist in the movement of food from the mouth to the stomach. What is the primary purpose of anti-embolism stockings for patients? A. To keep the feet warm. B. To reduce the risk of deep vein thrombosis, DVT. C. To improve mobility. D. To absorb sweat and keep feet dry. The correct answer is B. To reduce the risk of deep vein thrombosis, DVT. Anti-embolism stockings are designed to apply gentle pressure to the legs, improving blood flow and reducing the risk of blood clots forming in the deep veins, which can lead to deep vein thrombosis, DVT. What are the steps a CNA should follow when taking an oral temperature? A. Place the thermometer under the patient's armpit. B. Clean the thermometer, then immediately place it in the patient's mouth. C. Explain the procedure to the patient, ensure the thermometer is clean, place it under the patient's tongue, and ask the patient to close their mouth. D. Insert the thermometer into the patient's ear. The correct answer is C. Explain the procedure to the patient, ensure the thermometer is clean, place it under the patient's tongue, and ask the patient to close their mouth. Before taking an oral temperature, it's important to explain the process to the patient to ensure their cooperation and comfort. The thermometer must be clean for hygiene purposes. Placing it under the tongue and having the patient close their mouth helps ensure an accurate reading by keeping the thermometer properly positioned. What are the precautions a CNA must take when measuring a rectal temperature? A. Use the same thermometer for oral and rectal readings without cleaning. B. Ensure the patient is in a comfortable position and explain the procedure. C. Insert the thermometer at least 4 inches to ensure accuracy. D. Avoid using lubrication to increase the patient's comfort. The correct answer is B. Ensure the patient is in a comfortable position and explain the procedure. It's crucial to maintain patient comfort and safety. CNAs should explain procedures to patients to ensure they understand what to expect, helping to reduce anxiety and promote cooperation. The use of separate thermometers for oral and rectal readings, or at least thorough cleaning if the same one is used for both, is necessary to prevent cross-contamination. The thermometer should only be inserted a short distance, about 1/2 to 1 inch, with lubrication to prevent discomfort and injury. How does a CNA correctly locate the pulse points on a patient for pulse measurement? A. By feeling for the softest point on the wrist. B. By looking for visual signs of the pulse on the skin. C. By pressing down on the wrist using the tips of their first 2 or 3 fingers. D. By using a stethoscope anywhere on the arm. The correct answer is C. By pressing down on the wrist using the tips of their first 2 or 3 fingers. The correct way to locate a pulse is by gently pressing down on the wrist, specifically the radial artery, using the tips of the first 2 or 3 fingers. This method provides a direct and sensitive way to feel the pulse, avoiding the thumb, which has its own pulse that could interfere with accurate detection. What are the steps to correctly measure a patient's blood pressure using a sphygmomanometer? A. Inflate the cuff, place the stethoscope, read the dial immediately. B. Place the cuff, listen for heart sounds, then inflate the cuff until the gauge reads 200 millimeters of mercury. C. Place the cuff, inflate the cuff, listen for heart sounds with a stethoscope, slowly release the air, and read the systolic and diastolic pressures. D. Inflate the cuff to 100 millimeters of mercury, deflate immediately, and ask the patient for their usual blood pressure range. The correct answer is C. Place the cuff, inflate the cuff, listen for heart sounds with a stethoscope, slowly release the air, and read the systolic and diastolic pressures. The correct procedure involves placing the cuff on the patient's arm, inflating the cuff to a pressure higher than expected systolic pressure, then listening with a stethoscope placed over the artery as the air is slowly released. The first sound heard is the systolic pressure, and the point at which the sound disappears is the diastolic pressure. How should a CNA count a patient's respiration rate? A. By estimating based on the patient's activity level. B. By counting the number of breaths for 30 seconds and multiplying by 2. C. By counting the number of breaths for 15 seconds and multiplying by 4. D. By counting the number of breaths for a full minute. The correct answer is D. By counting the number of breaths for a full minute. Counting a patient's breaths for a full minute provides the most accurate measure of their respiration rate. This method accounts for any variations in breathing that may occur over a shorter period and ensures accuracy in the measurement. What does a systolic blood pressure reading represent? A. The pressure in the arteries when the heart is at rest. B. The pressure in the arteries when the heart beats. C. The total volume of blood in the body. D. The resistance to blood flow in the blood vessels. The correct answer is B. The pressure in the arteries when the heart beats. Systolic blood pressure measures the pressure in your arteries when your heart beats. It reflects the force your heart uses to pump blood around your body. What does a diastolic blood pressure reading indicate about a patient's health? A. The pressure in the arteries when the heart is at rest between beats. B. The pressure in the arteries when the heart contracts. C. The amount of oxygen in the blood. D. The volume of blood the heart pumps. The correct answer is A. The pressure in the arteries when the heart is at rest between beats. Diastolic blood pressure is a measure of the pressure in your arteries when your heart rests between beats. It reflects the minimum pressure to which the arteries are exposed. How should a CNA assess a patient's pain level? A. Guess based on the patient's condition. B. Use a standardized pain scale. C. Only ask the patient's family. D. Assess once and never reassess. The correct answer is B. Use a standardized pain scale. CNAs should use standardized pain scales, like the numeric scale, 0 to 10, or the FACES pain scale, to accurately assess a patient's pain level. This allows for a more objective measurement that can be communicated effectively to other healthcare team members. How does a CNA accurately measure and record a patient's fluid intake? A. Guessing the amount of fluid intake. B. Measuring only the fluid the patient drinks. C. using a standard measuring tool for all fluids ingested by the patient. D. Asking the patient to keep track of their own fluid intake. The correct answer is C. Using a standard measuring tool for all fluids ingested by the patient. Accurate measurement of fluid intake is crucial. CNAs must use a standard measuring tool, like a graduated cylinder or measuring cup, to measure all fluids the patient consumes, including water, juice, soup, and ice chips, once melted. This ensures that the healthcare team has precise data to make informed decisions about the patient's care. What is the normal pulse rate range for adults? A. 50 to 70 beats per minute. B. 60 to 100 beats per minute. C. 70 to 110 beats per minute. D. 80 to 120 beats per minute. The correct answer is B. 60 to 100 beats per minute. The normal resting heart rate for healthy adults is between 60 and 100 beats per minute. This range is considered optimal for heart health and efficiency. What is the normal pulse rate range for children? A. 60 to 100 beats per minute. B. 70 to 120 beats per minute. C. 80 to 130 beats per minute. D. 90 to 110 beats per minute. The correct answer is B. 70 to 120 beats per minute. The normal pulse rate for children varies significantly with age, but a general range for healthy children is about 70 to 120 beats per minute. This range can fluctuate based on the child's activity level and overall health. What is the conversion factor from ounces to milliliters, ml? A. 1 ounce equals 100 milliliters. B. 1 ounce equals 50 milliliters. C. 1 ounce equals 30 milliliters. D. 1 ounce equals 10 milliliters. The correct answer is C. 1 ounce equals 30 milliliters. This conversion is based on the fact that 1 fluid ounce is approximately equal to 30 milliliters. This approximation is widely used in healthcare to convert fluid volumes for medications, nutrition, and fluid balance documentation. Explain the significance of hand washing in breaking the chain of infection in healthcare settings. A. It's a quick way for healthcare workers to clean their hands. B. It removes visible dirt only. C. It prevents the spread of infections by removing germs from hands. D. It is only necessary after touching a patient. The correct answer is C. It prevents the spread of infections by removing germs from hands. Hand washing is crucial because it effectively removes germs from hands that can be transferred to others or to surfaces, thereby interrupting the chain of infection in healthcare settings. What specific measures should be taken when providing direct care to a patient under contact precautions? A. Use of gloves and gowns for all patient interactions. B. No special measures are needed for contact precautions. C. Only hand hygiene is required before and after patient contact. D. Use of an N95 respirator at all times. The correct answer is A. Use of gloves and gowns for all patient interactions. When caring for a patient under contact precautions, CNAs should wear gloves and gowns to prevent the spread of infections that can be transmitted through direct contact with the patient or the patient's environment. This is crucial to protect both the healthcare worker and other patients. Describe the steps for correctly donning PPE before entering a patient's room. A. Gloves, gown, mask, and eye protection in any order. B. Gown, mask, goggles or face shield, and gloves in that order. C. Mask only, as it provides sufficient protection. D. Gloves first, then any other PPE as available. The correct answer is B. Gown, mask, goggles or face shield, and gloves in that order. The correct sequence of donning PPE ensures maximum coverage and protection. Starting with the gown helps to cover the majority of the body, followed by the mask to protect the respiratory system, then goggles or a face shield to protect the eyes, and finally gloves to protect the hands. Explain why broken glassware that may have been contaminated with infectious agents should be placed in a sharps container. A. It is recyclable. B. To reduce environmental pollution. C. Because it can cause injuries and may be contaminated, posing a risk of infection. D. Glassware is easier to dispose of in sharps containers than in regular trash. The correct answer is C. Because it can cause injuries and may be contaminated, posing a risk of infection. Broken glassware that may have been contaminated needs to be treated as a sharp to prevent injuries and infections. Sharps containers are designed to safely contain items that could puncture or cut, including contaminated glass, protecting healthcare workers and patients from harm. How should CNAs handle linen that is heavily soiled with blood or bodily fluids to prevent the spread of infection? A. Shake the linen vigorously to remove solid particles before laundering. B. Rinse the linen in the patient's room before sending it to laundry. C. Carry the linen by hand to the laundry department without any protective bag. D. Where appropriate PPE, handle the linen as little as possible and place it directly into a designated leak-proof bag or container for soiled linen. The correct answer is D. Where appropriate PPE, handle the linen as little as possible and place it directly into a designated leak-proof bag or container for soiled linen. When handling linen heavily soiled with blood or bodily fluids, CNAs must wear appropriate personal protective equipment, PPE, to protect themselves from exposure. The linen should be handled minimally to prevent the spread of infectious materials and placed directly into a designated container or bag that is leak-proof to safely transport it to the laundry or disposal area, depending on the level of contamination. How can falls particularly affect older clients? A. They primarily cause minor bruises. B. Falls do not significantly impact older clients differently than younger clients. C. They can lead to serious injuries, prolonged hospitalization, and decreased independence. D. Older clients are less likely to fall than younger clients. The correct answer is C. They can lead to serious injuries, prolonged hospitalization, and decreased independence. Falls in older clients can result in severe consequences, such as fractures, a fear of falling again, and a reduction in their ability to care for themselves, leading to a decreased quality of life and independence. Describe the preparations CNAs should make for clients with mobility issues during inclement weather. A. Ensure that their mobility devices are stored safely away from them. B. Provide extra support and assistance, ensuring they can move to safe areas quickly and have access to their mobility aids. C. Leave clients with mobility issues in their rooms to keep hallways clear. D. Instruct clients with mobility issues to manage independently to build resilience. The correct answer is B. Provide extra support and assistance, ensuring they can move to safe areas quickly and have access to their mobility aids. Clients with mobility issues require additional support during emergencies, including inclement weather. CNAs should ensure these clients can quickly and safely move to designated safe areas, with easy access to their mobility aids, to protect them from harm. Describe the run, hide, fight strategy in the context of an active shooter event for a CNA working in a healthcare setting. A. Run to evacuate the facility if there is a safe path, hide if evacuation is not possible, and fight only as a last resort. B. Run around to find the shooter, hide clients in various locations, and fight the shooter with medical equipment. C. Hide immediately without attempting to run or fight. D. Fight the shooter as a first option to neutralize the threat. The correct answer is A. Run to evacuate the facility if there is a safe path, hide if evacuation is not possible, and fight only as a last resort. Run, hide, fight is a survival strategy recommended during active shooter events. For CNAs, this means attempting to evacuate the area with clients if safely possible, hiding and securing their location if evacuation isn't possible, and as a last resort, fighting back if directly confronted by the shooter. How can CNAs ensure they are informed about each client's current code status? A. Checking the client's medical chart regularly. B. Asking the client directly. C. Guessing based on the client's condition. D. Waiting for the client to inform them. The correct answer is A. Checking the client's medical chart regularly. The client's medical chart contains up-to-date medical orders, including code status. Regularly checking it ensures CNAs are informed about any changes to a client's code status. How can CNAs help to maintain essential medical equipment functionality during a power outage? A. Disconnect all medical equipment to save battery life. B. Use personal cell phones as a power source for medical equipment. C. Assist in connecting critical devices to backup power sources like generators or battery backups. D. Ignore the equipment as the power will likely return soon. The correct answer is C. Assist in connecting critical devices to backup power sources like generators or battery backups. During a power outage, maintaining the functionality of essential medical equipment is crucial for client care. CNAs can assist by ensuring that critical devices are connected to alternative power sources such as generators or battery backups to keep them operational until the main power is restored. What immediate steps should a CNA take upon recognizing that a client is showing signs of choking? A. Ask the client to drink water. B. Begin immediate abdominal thrusts, Heimlich maneuver. C. Encourage the client to cough if they can still breathe. D. Leave the client to find help. The correct answer is C. Encourage the client to cough if they can still breathe. If the client is showing signs of choking but can still breathe, coughing is the first step to try to dislodge the blockage. Encouraging the client to cough can help remove the object blocking the airway. If coughing does not work and the client cannot breathe, the CNA may need to proceed with more direct intervention like back blows or abdominal thrusts, Heimlich maneuver, depending on their training and the situation. Name the two fundamental techniques combined in the CPR procedure for adults. A. Chest compressions and rescue breaths. B. Arm lifts and back pats. C. Leg raises and abdominal thrusts. D. Finger sweeps and ventilation. The correct answer is A. Chest compressions and rescue breaths. The CPR procedure for adults combines two fundamental techniques, chest compressions and rescue breaths. Chest compressions help maintain blood flow through the heart to the rest of the body, while rescue breaths help provide oxygen to the lungs. How can a CNA ensure the client's comfort and safety while making an occupied bed? A. Changing the bed linens as quickly as possible. B. Keeping the client covered and checking for any signs of distress. C. Using a mechanical lift for all clients. D. Only adjusting the bed height once during the procedure. The correct answer is B. Keeping the client covered and checking for any signs of distress. Keeping the client covered maintains their dignity and warmth, while monitoring for distress ensures the procedure doesn't negatively affect their well-being. Quick changes, A, and adjusting bed height, D, are important but secondary to client comfort and safety, and using a mechanical lift, B, is situation-specific. How should a CNA approach dressing a patient with left-sided weakness differently from right-sided weakness? A. Start with the left side for both conditions. B. Use adaptive clothing for left-sided weakness only. C. Start with dressing the weaker side in both cases. D. Dress the stronger side first for both conditions. The correct answer is C. Start with dressing the weaker side in both cases. Whether the weakness is on the left or right, dressing the weaker side first accommodates the patient's needs better and facilitates easier movement for dressing. Describe the correct technique for tying restraints to ensure patient safety. A. Tightly, to prevent any movement. B. With knots directly against the patient's skin. C. Using quick-release knots attached to the movable part of the bed frame. D. Securing restraints to the stationary part of the bed. The correct answer is C. Using quick-release knots attached to the movable part of the bed frame. The correct technique involves using quick-release knots for easy removal in case of an emergency and attaching them to a movable part of the bed frame to prevent injury. This method ensures both the safety and dignity of the patient, allowing for some movement and quick intervention if needed. What are the steps for taking an axillary temperature accurately? A. Place the thermometer in the patient's mouth, wait for the beep, then read the temperature. B. Clean the thermometer, place it under the patient's arm, ensure good contact with skin, and wait for the reading. C. Insert the thermometer rectally, wait a few seconds, then check the temperature. D. Place the thermometer on the patient's forehead, wait until it beeps, and then read the temperature. The correct answer is B. Clean the thermometer, place it under the patient's arm, ensure good contact with skin, and wait for the reading. Accurately taking an axillary temperature involves cleaning the thermometer, placing it in the correct position under the patient's arm, ensuring it has good contact with the skin, and waiting for the device to indicate that the reading is complete. How should a CNA respond upon detecting abnormal vital signs in a patient? A. Immediately administer medications to normalize the vital signs. B. Report the findings to a nurse or healthcare provider immediately. C. Wait for an hour and recheck the vital signs before reporting. D. Record the findings and report at the end of the shift. The correct answer is B. Report the findings to a nurse or healthcare provider immediately. CNAs are not authorized to diagnose or treat conditions. Upon detecting abnormal vital signs, They should promptly report the findings to a nurse or healthcare provider so that appropriate action can be taken. How should the water temperature be tested before starting a bed bath? A. By touching the water with the back of the hand. B. By tasting the water. C. By measuring with a thermometer. D. By looking at the water. The correct answer is A. By touching the water with the back of the hand. The back of the hand is more sensitive to temperature changes than the palm. Using the back of the hand to test water temperature helps ensure it's warm but not too hot, preventing burns and ensuring comfort for the patient. What technique should be used to wash sensitive areas during a bed bath? A. Scrubbing vigorously to ensure cleanliness. B. Using a strong antiseptic soap. C. Wiping from front to back. D. Ignoring these areas to avoid embarrassment. The correct answer is C. Wiping from front to back. When washing sensitive areas, especially the perineal area, it is important to wipe from front to back to prevent the spread of bacteria from the rectal area to the urethra, which can reduce the risk of infection. How can a CNA prevent infections associated with indwelling catheters? A. Changing the catheter daily. B. Using sterile techniques when touching the catheter. C. Applying antiseptic cream around the catheter site. D. Limiting fluid intake to reduce urine production. The correct answer is B. Using sterile techniques when touching the catheter. Preventing infections involves using sterile techniques whenever the catheter or its components are handled to avoid introducing bacteria into the urinary tract. Changing the catheter daily is unnecessary and could increase infection risk, and while antiseptic cream might help in some skin conditions, it's not a primary method of infection prevention for catheters. What are the signs that a patient may be having difficulty swallowing during feeding? A. Coughing or choking during meals. B. Asking for seconds. C. Eating quickly. D. Preferring cold food over hot food. The correct answer is A. Coughing or choking during meals. Coughing or choking indicates that food might be going down the wrong way, into the airway instead of the esophagus, which can lead to aspiration pneumonia. This is a key sign of dysphagia, or difficulty swallowing. How does a CNA correctly measure a patient for anti-embolism stockings? A. By measuring the length of the foot only. B. By measuring the widest part of the thigh. C. By measuring the length of the leg from the thigh to the ankle and the circumference of the calf and thigh. D. By guessing the size based on the patient's height. The correct answer is C. By measuring the length of the leg from the thigh to the ankle and the circumference of the calf and thigh. The correct size of anti-embolism stockings is crucial for their effectiveness and comfort. A CNA measures the length of the leg from the thigh to the ankle and the circumference of the calf and thigh to ensure the stockings will fit properly and provide the right amount of pressure. How long should the thermometer remain in the patient's mouth to ensure an accurate reading? A. 10 seconds. B. 30 seconds. C. At least 1 minute. D. 3 minutes. The correct answer is B. 30 seconds. Most modern digital thermometers can provide an accurate reading within 30 seconds. It's essential to wait this duration to ensure the thermometer has enough time to accurately measure the body's temperature. How is a rectal temperature reading different from an oral temperature reading? A. Rectal readings are usually lower than oral readings. B. Rectal readings are generally considered more accurate and slightly higher than oral readings. C. There is no difference in temperature readings between the two methods. D. Oral readings are more invasive than rectal readings. The correct answer is B. Rectal readings are generally considered more accurate and slightly higher than oral readings. Rectal temperatures are usually considered more accurate reflections of the body's core temperature and are typically a little higher than oral temperatures, due to the close proximity to the core and less exposure to external factors that might cool the mouth. What should a CNA do if they detect an irregular pulse while taking a measurement? A. Stop measuring and move to another task. B. Report the irregularity to a nurse or supervising healthcare provider immediately. C. Ignore it as long as the patient seems comfortable. D. Increase the pressure on the pulse point to regularize the pulse. The correct answer is B. Report the irregularity to a nurse or supervising healthcare provider immediately. It's crucial to report any irregularities in pulse rate, such as irregular rhythms or unusual rates, to a nurse or supervising healthcare provider. These could be indicators of underlying health issues that require professional attention. How does body position affect blood pressure readings? A. Body position has no effect on blood pressure readings. B. Blood pressure readings are higher when the patient is standing. C. Blood pressure readings can vary with changes in body position. They may be different when lying, sitting, or standing. D. Blood pressure readings are always lower when the patient is sitting. The correct answer is C. Blood pressure readings can vary with changes in body position. They may be different when lying, sitting, or standing. Blood pressure readings can indeed vary depending on the patient's body position due to changes in the heart's level relative to the rest of the body. It's typically lower when lying down and may increase when sitting up or standing. What are the characteristics of normal versus abnormal respirations a CNA should note? A. Color, temperature, and humidity. B. Rate, rhythm, and depth. C. Noise, smell, and duration. D. Frequency, taste, and intensity. The correct answer is B. Rate, rhythm, and depth. Normal respirations are characterized by an appropriate rate, usually 12 to 20 breaths per minute for an adult, a regular rhythm, and an adequate depth that fully expands the lungs. Abnormal respirations may deviate in rate, too fast or too slow, rhythm, irregular, or depth, too shallow or too deep, indicating potential respiratory distress or other health issues. How can a CNA identify if a systolic reading is abnormally high or low? A. By checking if the reading is above 120 millimeters of mercury or below 80 millimeters of mercury. B. By ensuring the reading matches the patient's age. C. By comparing the reading to the average blood pressure for adults. D. By checking if the reading falls outside the normal range of 90 to 120 millimeters of mercury for systolic pressure. The correct answer is D. By checking if the reading falls outside the normal range of 90 to 120 millimeters of mercury for systolic pressure. A normal systolic blood pressure is typically between 90 and 120 millimeters of mercury. Readings above or below this range can be considered abnormally high or low, respectively, indicating potential health concerns. What are the implications of a low diastolic reading? A. It indicates high cardiovascular fitness. B. It suggests potential for heart disease or stroke. C. It signifies an increased risk of dehydration. D. It can indicate poor blood flow and insufficient oxygen to the heart. The correct answer is D. It can indicate poor blood flow and insufficient oxygen to the heart. While a low diastolic pressure might seem beneficial, if it is too low, it can mean that the heart is not receiving enough blood and oxygen between beats, which can be harmful. What are the nonverbal signs of pain a CNA should be aware of in non-communicative patients? A. Smiling and relaxation. B. Constant talking and laughter. C. Grimacing, moaning, or restlessness. D. Increased socialization. The correct answer is C. Grimacing, moaning, or restlessness. Non-communicative patients may not be able to verbalize their pain. Thus, CNAs should be observant of nonverbal cues such as grimacing, moaning, or restlessness, which can indicate that the patient is experiencing pain. What methods can a CNA use to measure a patient's output accurately? A. Estimating the amount visually. B. Measuring only urine output. C. Ignoring insensible losses such as sweating. D. Using a graduated container to measure all liquid output. The correct answer is D. Using a graduated container to measure all liquid output. Accurate measurement of patient output is as important as intake measurement. This includes all liquid outputs, such as urine, vomit, and diarrhea, and should be measured using a graduated container. Insensible losses like sweating are also considered but are harder to measure directly. How does activity level affect an adult's pulse rate? A. Increases pulse rate. B. Decreases pulse rate. C. Has no effect on pulse rate. D. Initially increases, then decreases pulse rate. The correct answer is A. Increases pulse rate. Physical activity increases the heart rate because the body requires more oxygen and nutrients during exercise, which are delivered through the bloodstream. Therefore, the heart pumps faster to meet these increased demands. How does age affect the normal pulse rate in children? A. The pulse rate decreases as children grow older. B. The pulse rate increases as children grow older. C. Age has no effect on the pulse rate. D. The pulse rate is constant from birth to adulthood. The correct answer is A. The pulse rate decreases as children grow older. As children grow, their heart grows larger and becomes more efficient, pumping more blood with each beat. Consequently, the pulse rate generally decreases with age. Why is accurate conversion between ounces and ml important in healthcare? A. Ensures that medications are given in a fun way. B. Helps in decorating the patient's room. C. Ensures accurate medication dosages and fluid intake/output measurement. D. Makes the paperwork look more complicated. The correct answer is C. Ensures accurate medication dosages and fluid intake/output measurement. accurate conversions are crucial for maintaining precise medication dosages, nutrition, and monitoring a patient's fluid balance. This ensures patient safety and effective care. How long should the hand washing process last to effectively remove germs? A. 5 seconds. B. At least 20 seconds. C. 1 minute. D. 10 seconds. The correct answer is B. At least 20 seconds. The CDC recommends washing hands for at least 20 seconds to effectively remove germs. This duration is crucial for ensuring all areas of the hands are thoroughly cleaned. How should CNAs apply droplet precautions differently than airborne precautions when caring for patients? A. Both require the use of an N95 respirator at all times. B. Only gloves are required for both droplet and airborne precautions. C. No mask is needed for droplet precautions, only for airborne precautions. D. Droplet precautions require the use of a surgical mask, whereas airborne precautions require the use of an N95 respirator. The correct answer is D. Droplet precautions require the use of a surgical mask, whereas airborne precautions require the use of an N95 respirator. Droplet precautions are used for diseases spread through large respiratory droplets, requiring a surgical mask. Airborne precautions are for diseases that are spread through smaller aerosols, requiring the use of an N95 respirator to protect against inhalation of infectious particles.